To the member for Curtin.
Thank you. Families of kids with developmental delay or autism in Curtin are understandably concerned about the shift to the Thriving Kids program. They mostly know that the system doesn't work well now, but they want to ensure that they don't lose the support that they've worked so hard to get for their kids. And I've engaged with families, educators and health professionals in Curtin to understand their experience seeking diagnosis and support for kids, and have made a submission to the Thriving Kids Committee inquiry based on the experience of my community. There's no doubt there are problems with the current system. Results of our Curtin survey show that more than 70% of respondents found it difficult to access identification and support services for children with mild to moderate developmental delay or autism. Almost all respondents had experienced delays in accessing assessments or interventions, with 73% reporting frequent delays. Respondents had mixed views about how well services have met the needs of children with mild to moderate support needs in our community. When asked what would help families and service providers better navigate the system of supports for children with additional needs, my community had some really useful suggestions about simplification, clarity and accessibility. Families want clear, centralised information so they can navigate their journey through diagnosis and support. They want streamlined processes to ensure consistent NDIS or support rules and improved transparency about wait lists and service availability. They want to see more trained specialists, reduced wait times and more affordable assessments and services. They'd like to see early intervention integrated into schools with better early screening and more support to equip schools to support neurodiverse children. A consistent theme was the importance of involving people with lived experience in service design and delivery. My submission makes 11 recommendations which call for a streamlined, inclusive system that enables early identification and support for children with developmental delays through trained mainstream professionals, clear eligibility criteria and integrated therapy services. Delivery should leverage existing WA infrastructure, involve families in service design, address workforce shortages and be backed by increased funding and professional development. Parents want to be met with empathy and clarity, not bureaucracy and confusion. Educators and clinicians are calling for better collaboration between health, education and disability sectors. They know that when we intervene early and work together, we can change the trajectory of a child's life. There's significant concern about the prospect of losing or reducing support when the Thriving Kids change is made, but our Curtin submission is grounded in the hope that we can build a system that listens to families, supports professionals and puts children at its centre.
Thank you. And I give the call to the member for Richmond.